I'm Dr. Stephanie Canale, and I am the CEO and co-founder of Lactation Lab, which is the only US company testing breast milk. Nutrition during the first 1,000 days of life is critical for infant development. It's a time of vulnerability and presents an opportunity to positively impact lifelong health. Breast milk is recommended as a sole source of nutrition for the first 6 months of age, and ideally until age 2. Due to the health benefits alone, breastfeeding is at a 100-year high again. So versus in 2010, 95% of moms are breastfeeding now. And there's also a healthcare savings involved here too. For every 5% increase in the number of women who breastfeed, this results in a $400 million savings each year in the United States alone. And this is because breastfed babies get sick less often, and mothers who breastfeed are less likely to develop chronic illnesses such as diabetes, metabolic syndrome, even breast and ovarian cancer. So despite these facts, the individual nutritional makeup of a mother's milk remains a black box. 92% of women report having issues breastfeeding. Over 50% of women stop early just because they think their milk isn't good enough. And the inability to continue feeding or wanting to feed your child the way that you choose to or want to, or hoping that your body would work itself out to do, actually can lead to a lot of anxiety, shame, and depression. And this is something that unfortunately I know all too well. So Lactation Lab was born out of my clinical experience of 15 years as a family doctor at UCLA, having treated thousands of moms and babies, but also my personal experience as a mother who failed to breastfeed. My daughter was diagnosed with failure to thrive. This meant that she was not growing properly. This meant that I was not feeding her properly, yet there was no tool that existed for me to figure out how to solve the problem. And I'm on a mission to give other families the services and information, not only that I wish I had, but that I needed. Breastfeeding itself is also a big business. The sales of breast pumps alone in the last 2 years have gone from 300 million annually to over 2 billion. How it works is a mom collects a milk sample in the comfort of her own home, freezes it, sends it into our lab at UCLA. We analyze it, and she receives the personalized dietary and lifestyle recommendations she needs to optimize her milk and replenish her stores. Testing milk has also shown to prolong breastfeeding rates. We have an even bigger vision to support our moms and babies. And so we just launched our telehealth services and our companion app named Emily to help support women through their journey from preconception counseling through pregnancy, lactation, and returning to work. And we are on a mission to build the first, most comprehensive database of maternal behaviors, nutrition, and milk analyses, positioning us for key plays in diagnostics and therapeutics. We sell direct to consumer, and we also have a corporate wellness program, 3 tiers of kits. We have our revenue's grown exponentially since COVID pandemic began. We formed strong partnerships. We have ecstatic customers and patents pending. We're currently raising a seed round, of which we have a third already committed, and we hope to grow, and we're also looking for more partnerships, especially in the payer space. Our team is poised for growth, and we've created a patient-centered, holistic approach to maternal child health, focusing on breastfeeding as our core connection. And if our vision of empowering moms with data to be their best selves and help their children thrive excites you, we'd love to talk. Thank you.
Thank you, Stephanie. Great job. Matt Clancy, can you come off mute and ask your question, please?
Yeah, good afternoon. Thanks for the presentation. That was really interesting. I'm part of LabCorp, and we've obviously had some interest in failure to thrive, other areas to help infants, especially thinking about preterm infants. You know, I think some of the areas that have a lot of evidence in that space as well are in microbiome profiling. Have you thought about pairing your testing alongside microbiome profiling of infants and possibly mothers?
That's actually in the works. Our research facility was partially shut down for the last 4 months, so that's part of what we're doing. We're also launching an at-home test strip for mastitis to help distinguish between inflammation and infection and hopefully limit antibiotic use amongst nursing women, which we know, again, adversely affects the microbiome, but that's coming.
Awesome. Thank you.
Okay. And since the quick question I'll ask on behalf of Roberto from Humana, do you have your own lab?
Yes, we have our own lab and patents around the testing methods.
Awesome. And Vince, why don't you come off mute and ask your question?
Absolutely. My simple question is, what engagement have you seen after you launch your app? And has it in a positive direction, and do you see more engagement? And what kind of things are you seeing with or without app?
So our app will be launched in 2 weeks. It's not launched yet. In terms of our engagement, though, we've tested over 5,000 samples of milk. And we are in revenue. We've actually even have had a couple months of profitability too.
So the question of engagement was, what you would like to see with the app launch? What delta change will happen? Yeah.
Yeah, this is the first app that, you know, a lot of times when mothers are breastfeeding, it's important to keep track of, and there's very little tools that mothers have to really know what their child is getting. Right now, it's just timing of breastfeeding, weight, and counting the number of diapers. So they count and track the number of pee diapers and poo diapers. And in this app, this is the first one that's going to proactively check in with mom. So this is mother focused on not only are they tracking baby behaviors, but checking in with mom also from a mental health perspective too.
Einar, why don't you ask your question?
Thank you. This is back to my bone health side of my job. So the CDC came out recently in the last few years, said we don't see enough vitamin D in breast milk being transmitted. So all infants on breast milk should be supplemented with 400 IU. But across the board, that's like saying everybody's the same. So to get more to precision on that, have you been testing for vitamin D? What are your findings? And it seems like it would be very important for us to be able to tie our recommendations to the actual individual mother's breast milk, vitamin D being just one example.
Well, I couldn't agree enough about that. Vitamin D, the reason why it is not in our current panel of testing, it'll be out by the end of by the fall, is because of the cost. It's a very expensive test to do. And this 400, first, milk of all species is low in vitamin D, and these blanket statements and recommendations is really what we're moving away from, and more personalized medicine, because not everybody needs, you know, some need 1,000 IUs of vitamin D. Vitamin A is another one. A lot of mothers go on very restricted diets when they're breastfeeding too, whether they're avoiding dairy, whether they're vegan, vegetarian, whatever it may be, and it's figuring out what that child needs. And yeah, so that's the mission we're on. So vitamin D is coming soon. Thank you for asking that question.
Awesome. And that was Einar Sawyer from UCSF, a longtime friend of StartUpHealth. So we're just wrapping up here. As a final question, Stephanie, can you tell us about your strategy for targeting moms, your go-to-market strategy, your marketing strategy? What's, you know, how are you going about that?
Yeah, so far, I mean, we're a bootstrapped company. So far, it's been word of mouth. There's a lot of interesting, it's interesting in the mommy world. There's a lot of lack of evidence-based guidelines and information out there. And so we're really trying to position ourselves as the authority of milk. Not that we're the breastfeeding, and we know everything about breastfeeding, but we do know everything about the milk. And so we're really trying to give our moms a lot of evidence-based, you know, information at a time, and provide a lot of, I mean, we're really on a mission here to stop guessing about things and help women have data and information if they want to. And so we've grown. We have almost 30,000 followers on Instagram. We have our Lactation Lounge Facebook group, and this has all been word of mouth. And yeah.